Good evening, listeners, and a warm welcome to Views on Health. And as the 30th of December comes by, and we know that the 1st of December is World AIDS Day, a day that is set apart to draw attention to HIV/AIDS, which has afflicted people around the globe. Focusing on Sri Lanka, since the first case was detected in the year 1987, it's 33 years since then, Sri Lanka has made many strides in combating the disease as well as addressing the issues that have come about when so many Sri Lankans at the start were actually fighting shy to come forward to say that they may be affected or they need to be tested. But the continuous awareness and the approach, the kind approach and the holistic approach that was adopted by the health sector, that is essentially the National STD/AIDS Control Program of the Ministry of Health, has made many positive strides in detecting cases, in society also slowly changing their mind. People across the board in Sri Lanka changing their mind slowly but steadily to accept that this is not as bad as it may have been at the outset. Having said by way of an introduction there, a warm welcome is extended to Dr.K.A.M Ariyaratne, Consultant Venereologist of the National STD/AIDS Control Program of the Ministry of Health. As a matter of fact, Dr. K.A.M Ariyaratne pays an annual visit to SLBC when World AIDS Day is around the corner to speak to you, our listeners, and explain what is the current status. So, having said that, over to you, Doctor. Welcome to our studios once again, and to give us an overview of HIV/AIDS, first in Sri Lanka, and some global information would also be useful.
Thank you, Fatima, having me this year as well. As you know, tomorrow we are commemorating World AIDS Day, and as you know, this event is commemorated to show our support to people living with HIV and also to remember people who have lost their lives due to AIDS. So, as you correctly said, it's 33 years since the first case reported way back in 87 in Sri Lanka. And before we talk about Sri Lankan statistics, I would like to talk about the global situation. The latest figures, estimated figures, are available for 2019. According to that one, currently there are 38 million people infected and living with HIV. And last year alone, 1.7 million newly infected with HIV and 700,000 or 0.7 million people have died due to AIDS-related deaths in 2019 alone. So coming back to Sri Lankan numbers, we update our numbers at the end of each quarter. So up to now, 2020, we have got second quarter data updated. So the total number reported, the total cumulative number reported so far is 3,816. Of these, 1,363 people have already died. So we can roughly take this figure, the total number of reported figure at the end of 2020 is, say, 4,000, and of these about 1,500 people have been already dead and gone. So the number diagnosed and living with HIV is around 2,500. And at the same time, I should say that we estimate there should be around 4,000 people living with HIV. So since 1,500 people have died, so there should be about 2,500 people living with HIV, and they are the people we have diagnosed. So that means out of 4,000, we have diagnosed only about 2,500 cases. That is about 63-64% only. So we have certain number of people already infected with HIV, but we have not diagnosed them, so they are not aware about their HIV status. So that is one of the biggest challenges we are having.
Thank you for that introduction, Doctor. And so Sri Lanka, there is about a 33% approximately that you still need to, from estimated figure, you need to detect and treat, obviously, but the fact remains that they have to present themselves as our listeners would appreciate. Definitely one cannot go and say, do you have AIDS? Can I test you? No. So it's up to the person concerned if he or she feels any of the symptoms, the signs are there, and then it's obvious the correct thing to do, and in their own interest to begin with, is to seek proper medical attention through the National STD AIDS Control Program of the Ministry of Health. But I'm sure, as to the best of our knowledge, the services of AIDS control are available island-wide in Sri Lanka. So one need not actually come to the main clinic, but wherever they are, any part of the country, they can go to the closest hospital and get themselves tested and treated. And it goes on in that vein. Having said that, Doctor, now a lot of awareness has been created in Sri Lanka, which certainly augurs well for our little country. And that has also, I think, to a great extent, reduced the attitude of the public, general public, in dealing with a person who is so afflicted in society, in places of work, within families, within neighborhoods. I think people are becoming more tolerant, if I may put it that way, towards a person who is so affected. How do you propose to try and trace these people who are yet to be found, so to speak? I mean, if not the approximate 1,005 who are just, in your estimate, floating around somewhere in the country, how best can you sort of muster as many as you possibly can?
Fatima, now there are two types of people. Certain people are not perceived that they are at risk of HIV, therefore they are not going forward to get a HIV test done. But certain people, they know they have high-risk behaviors and probably they are infected, but they are reluctant to go to a service thinking that they will get discriminated or stigmatized during this process. So there are two types of people. So what we do is create a general awareness, but that general awareness might not reach the most needy people. If you get a general population, not everybody is at the same risk of getting HIV. Certainly there are special groups who are most at risk of getting HIV. We name them technically as key populations. So they includes men who have sex with other men, those who do transsexual sex work, and those who are injecting drugs, and also those who are in incarcerated settings. So we have specially targeted testing programs for these groups we are promoting, and also we are also going to introduce a new testing program called HIV self-testing, where people, if they perceive them that they are at risk of getting HIV, they can request a test and we can provide that test, and then they can do their own test, and based on the results, they can take the action. So this is a new thing that we are hoping to initiate next year. So this year, still, they have to come to a service provision center, like a STD clinic or a hospital. And now we have this rapid HIV testing where you can provide the result within 20 minutes. On the other hand, usual conventional serological test might take longer time, and we usually give them a time of 1 week to come back for results. And we experience that some of the people never come back to get their results. So receiving results is very important, because even if they're negative, they can remain negative and get the necessary input not to get infected. If they are positive, certainly they can link with our services where we can provide them treatment. And once they get the treatment, they can live a happy and productive life. So there are so many people, those who are even in responsible positions, they are on this treatment and having their both job and family life, they are spending their life very productively. So that is a reality. Unlike early 80s, where at that time AIDS mean kind of death sentence, but now we have come a long way, and we can provide treatment so that people can be, they can come back to the normal life almost. But they have to be on treatment for the rest of their lives, because at the moment, unfortunately, there is no cure. But you never know, in years to come, there might be even a cure. We never know. But at the moment, what is important is you have to know your status, whether you are infected with HIV or not. If you are not infected, most of the people are not infected, so they have to remain that way. If you are, unfortunately, if you are infected, then go to a service and get treatment. And that treatment is provided from government funds free of charge. So for the person concerned, they don't have to pay anything. It's all free. And also our staff is very sensitive about the nature of the illness. And we keep all this information confidentially. Even we don't reveal their status to anybody, to government authorities or even to their family members, without getting their consent or concurrence. Otherwise, we will never ever divulge it to anybody. So people do not have undue fear. Come and get a test done, and then, depending on the result, do the needful. That's my advice.
Thank you, Doctor. To our audience out there, that's very, very reassuring to know that, all along, it's not just today, but from the very inception, confidentiality was key and has been enforced, and the health sector that deals with this issue certainly does not divulge any information to anybody of A, B, or C who may be affected. And so that has always been a very, I would say, plus point, as it should be, wherever in the world. And Sri Lanka is no exception, and the health sector here has taken every possible measure to ensure that the details and the vital information of a patient who comes into the STD clinic is taken care of, and nothing is divulged to the general public. Having said that, Doctor, it also augurs well for a country like Sri Lanka to have this new testing program that you spoke of, the HIV self-testing. That I think is something really tremendous again for Sri Lanka, and that would help people to do the test themselves, whatever the procedure is concerned. And end of the day, if they're negative, all well and good. And then they certainly need to take some sort of lifestyle modification so as not to get into the danger zone. And the other side of it is that if they are positive, nobody will know they've done it themselves. So would it be possible, Doctor, to tell us how this self-testing will work?
Well, actually, the exact method of doing it, we are still in the discussion stage. But in other countries, there are different methods they have been following. There are some websites where they publish this service, and if somebody want to get themselves tested, and then they can order a test online, and then the test kit will be couriered to their home, so they can home or wherever the place that they want to get it delivered, and they themselves can do. It is just it is not a blood test or something. It is usually a test done using oral fluid, so they can take a swab and see whether they are infected or not, and then they can enter the result and get advice as to what to do. So in other countries, it is not new in other countries. It is just new to Sri Lanka. And similarly, we have a website called Knowforsure.lk. There, we encourage people to assess their risk, and if they are at risk, then they can book an appointment in one of these STD clinics, and then once they reach the clinic, there are online outreach workers who will facilitate their process of going through the clinic, because a lot of people are very apprehensive of coming to STD clinic and getting tested done, these procedures done, but these people will facilitate that. So similarly, in the same website, we are going to promote self-testing also. So next year, it will be a reality. At the moment, we are in the process of planning as to how best we can do it in Sri Lanka, because we can't directly copy the same model practiced in a Western country. So we have to think about our setting, our people, and then discuss with them and select the best method for us.
That is modified to suit our setup.
Exactly. That's always we do. Whatever the thing come from other countries, we always discuss among ourselves and among the people who are going to use this service, and then only we take a final decision. Even initially, most of these things are done as a pilot project. So based on the results of that project only, we are going to scale it up to other places.
Thank you, Doctor. This rapid HIV testing you spoke of a while ago, where the results are out in 20 minutes, how does that work?
Well, it's a small blood sample, maybe a finger prick, or even it can be a venous blood sample. And there are these test kits. They have been around for many years. And we have been using them for emergency purposes, like, if somebody get a needle prick injury, we have to immediately know whether the source patient is positive or not, because if the source patient is positive, then we have to start treatment on the other person immediately. So likewise, we have been using it in a small scale, but we want to scale it up, because a lot of people find they want to know the result then and there, because they can't give a blood sample and come after 1 week, because that 1 week is a real agony. They really, those who are really going through this one only can explain that. They can't wait 1 week, and they might not come for after 1 week. So we have to make sure that while they are waiting, we give the result and give the necessary counseling and advice and link them to services if necessary, then and there.
Thank you. That too is something that I think will help in the overall process of getting more people to come to the clinic when they know that they will know in 20 minutes' time whether they are HIV positive or not. Because as you quite rightly say, I think the mental anxiety that they go through for a week can be very, very difficult, and when they're living in with families and going into work. So that I think also the fact that of course it's restricted to certain situations where you have to do it, but at the end of the day, that too if can be scaled up, I think might be
exactly. That's what we are going to do. Next year, that also will be scaled up to district STD clinics and to many more settings, where at the moment we are doing a usual blood sample the usual way and ask them to come after 1 week. We are going to scale it up at least for most of this population, all of them, because they are the most needy people.
Doctor, going on from there, now you spoke of your your website, knowforsure.lk. I'm not sure whether the general public is that aware of this online facility that you have. Could you elaborate on that, please?
Well, this website we developed and deployed last year, and if anybody can, just type knowforsure.lk or just even HIV/AIDS, and that will come as one of these websites. So there they have to log in, and then they can assess their risk. So this is mainly designed for people who are at higher risk of getting HIV, like, men who have sex with men, sex workers, and drug users, as I told before. So they can log in and assess their own risk. So based on the risk, they can take action. If they are at a significant high risk, they can always make an appointment to the clinic, and then there are online outreach workers who will contact them and facilitate their clinic visit, as I told you before. Yes, a lot of people may not aware about this service, so we want to, and we have proposed, certain amount of budget from Global Fund next year, especially to make it more public. And it has to be a targeted publicity. It is, we don't want to publicize it in mainstream media and all that, but there are certain social media sites where they reach directly to these needy people. So we have a fairly significant amount of budget proposed, and I hope that will get approved. So with that one, we are going to publicize directly into these needy people. That's what we are going to do.
Thank you, Doctor. In fact, I would like to, at this point in time, digress just for a few moments to reiterate the fact that Sri Lanka, with all its difficulties, more so now with the corona pandemic, which has affected the entire world, and we are no exception, and it has impacted so much on the economy of our country. And in the midst of all of that, our health service is totally free. The government health service I'm talking of is totally free, and the Ministry of Health is doing a tremendous job through its network of medical specialists across the country to provide the very best of medical service free to every citizen if he or she wants to access it in a government hospital. Having said that, this is a tremendous, I would say, a dent, I would say, into one's health budget when such services are given free of charge, yet it's being done. Now, Doctor, end of the day, could you also tell our listeners the type of services that are available to the people who may be wanting to access them across the country?
Okay, as you rightly said, in 2020, the COVID-19 epidemic is very much in focus. But, that is a pandemic, and AIDS had also been a pandemic. So there are two pandemics, colliding and creating big problems. So COVID-19 pandemic showed us the importance of, the health, the effects of health on economy and all that. So in countries where HIV also is a big problem, the same issue they had been facing. So fortunately, we had some funding from grants in previous years, but now the funding is, most of the funding is directly from the government. For example, if somebody is on antiretroviral treatment, so the government has to spend about 1 million rupees per year for drugs, the tests, and other related things. So it's a huge amount, and currently there are over 2,000 people who are on treatment. So it is important to get treatment, but it is more important to prevent people getting HIV, remain negative, because otherwise it will be a huge burden to our health budget, because ours is a small economy, and the proportion allocated for health is also not that big, because we can't afford more than that. So we should wisely spend our health budget. But if somebody is HIV infected, we have no other option but to provide these services. So for somebody with HIV, not only the treatment of the antiretroviral treatment, but the treatment of the tests, certain tests, for example, to test how much viruses in the blood, like viral load test, that is about 10,000 rupees. So, and we have to do more than one test in a year for one person. So overall, nearly 1 million is spent because certain drugs are extremely 1 million rupees a person per year. So certain drugs are extremely expensive, the new drugs. Older drugs are not that expensive, but overall I'm telling you the average figure. So that kind of services we are providing from our network of STD clinics. We have 40 STD clinics island-wide. So 1 or 2 clinics every district, at least 1 clinic every district. So they are not only we look after people who are already infected with HIV, those who are who want to get themselves tested for HIV and STIs, we provide them free testing, diagnostic facilities, and also we do all the counseling, the advising them, and all the facilities we provide free of charge. But because of this COVID-19 pandemic, some of our services also getting affected very badly, because suddenly if there is a person who is infected with COVID-19 in staff or in one of the patients, then we have to temporarily close the thing, and it is affected their families and all that. So the skeletal staff is being used to run the services. But we have made sure that people are getting ART on time, because once somebody on ART, they have to take the treatment without any interruption throughout. So some people are from outstations, and we have also provided, there are some tourists who are stranded here they can't get a flight. So even for them, we have been providing treatment free of charge, because it is important that we provide treatment to everybody. Then their viral load is suppressed, so they can't transmit the virus to somebody else. So we can't leave anybody behind. So we are providing that kind of services as well. So every once and 2-3 times a week, we are getting, we have a website in our program, National STD/AIDS Control Program website. So there anybody be in distress, with I don't have ART, my ART is over, I'm from say this country, can you please give? So we always oblige them. We say you go to the nearest STD clinic and you can get the treatment until you leave the country. So for both locals and even if they are non-Sri Lankans, still we have been providing those services.
That's really, really tremendous to know, Doctor, and I'm so glad that Sri Lanka is extending this service, being so humane and extending to every person, irrespective of whether he or she is a national of the country or a visitor. Having said that, time is catching up with us, and I would like to know what your take-home message is.
Well, my take-home message, as always, was always for HIV/AIDS, don't take undue risks which can lead to an HIV or STI infection. And if you have already undergone that kind of a risk, risk means unprotected sex with an infected person. So if you have already suspicious of that kind of activity, it is your responsibility to test yourself, to know your status, and based on the status, do the needful. For example, most of the people will be negative, that's for sure. So if it is negative, it's a good thing. So you have to remain negative for the rest of your life. There are things that can be done actively to remain negative. Or in the unfortunate event of getting a positive result, still we have to make sure that it is a real positive test. You have to undergo a confirmatory test. So even if that is also positive, then best thing is to initiate treatment, link with one of these treatment centers, and follow all the instructions and get the treatment on a regular basis. So that's the best thing you can do for you as well as for your families and also for the society.
Thank you so much, Doctor. And on that note of advice, we end this very interesting discussion, which was an overview on HIV/AIDS to mark World AIDS Day, which falls on the 1st of December. We place on record our grateful thanks to Dr. K.A.M Ariyaratne, consultant venereologist of the National STD AIDS Control Program of the Ministry of Health, for sparing your valuable time in the midst of your busy schedule to be with us on the program and share your expert knowledge on this very vital topic. Thank you very much, Doctor.
It's always a pleasure.
And we wish your program at the National STD AIDS Control Program of the Ministry of Health every success in all your endeavors.
Thank you very much.
My thanks also go to Manjula Senviratne for technical assistance. I'm Fatima Razi Qaida saying good night and hope to catch you next Monday, same time on Views on Health.